Hi, Andre. This is Mr. Bear, and we need all those things for his IV.
Hi, Mr. Bear.
To access a peripheral vein, first reduce the child's anxiety and increase his sense of control. For example, let a younger child play with the equipment, using it on a stuffed animal or doll.
Let's feel. Can you feel it? Look for a vein. This one looks good. Can you feel that right there? Good job.
Okay, Andre. Just like the bear, we're going to find a vein for an IV, okay?
Then, with the child positioned comfortably, select the IV site and an alternate site. For most children, expect to use a vein in the non-dominant hand, wrist, or antecubital area. For an infant, consider using a scalp vein. In any child, you may use another vein, but should avoid a foot vein in a child who is just learning to walk. After putting on gloves, use a gauze pad to remove the topical anesthetic if it was applied earlier. Then apply a tourniquet above the selected site. By wrapping the tourniquet over the child's clothes or a washcloth, you can prevent it from pinching his skin. Next, clean the site with an antiseptic solution, spiraling out from the center to cover an area about 2 inches in diameter. While allowing the child's skin to dry, inspect the catheter to check for damage. Break the seal between the stylet and catheter by gently twisting and separating them slightly. Then stretch the child's skin taut to help stabilize it, and gently rub or tap the vein gently to make it more visible. If you take this step, clean the skin again afterward. If needed, restrain the child's arm. Then with the bevel up, insert the catheter at a 15 to 30 degree angle and advance it into the vein a few millimeters. Observe for a blood return in the flashback chamber to confirm correct catheter placement. After you see the blood return, decrease the angle between the catheter and the skin to 15 degrees. Advance the catheter 1/16 to 1/8 inch so that the stylet and catheter are inside the vein. Then push the catheter off the stylet until the catheter hub rests against the skin. Remove the stylet while keeping pressure on the catheter to avoid backflow. Remove the tourniquet, then attach the extension tubing and add a junction securement device if needed.
There you go. Would you like me to pull back? Sure. Okay. We're just taking a little bit of blood. We're going to send that blood to the lab. You did really good.
Next, flush the IV line with normal saline to confirm its patency. If the line flushes easily, secure the catheter. To do this, apply a transparent dressing over the catheter hub, or tape it as required by facility policy. Now loop the tubing from the catheter hub toward the IV fluid source. Tape the looped tubing onto the transparent dressing. If the child is likely to dislodge the catheter, cover the hub and looped tubing with a plastic shield, IV house, or other device, according to facility policy.
Is just put this house on there. It's just a little piece of plastic.
After the procedure, plan to check the site at least every hour when fluid or medication is infusing. If the child is discharged with a venous access device, teach his parents how to flush and assess it, and instruct them to report any problems promptly.
Okay. Bobby, now we're going to give you your medicine. Okay?
To administer medication through an intermittent infusion device or medication lock, first reassure the child that it is painless and instruct him to remain still for the procedure.
May 2nd, 1990.
Thank you. And this is your antibiotic, okay? So I'm just going to check your name band against your med.
With the child positioned comfortably, check his IV site for signs of complications, such as redness or edema.
Your med. So first what we're going to do is just
Using an antiseptic swab, clean the injection port on the intermittent infusion device. Then insert a syringe of normal saline into the injection port. Gently pull back on the plunger and watch for a blood return, which may or may not occur in a child.
Now we're going to clean again and then give your antibiotic. Did that hurt?
Now flush the intermittent infusion device. If it won't flush, or if you detect infusion site redness, edema, or pain, do not apply force, but start a new device elsewhere. Using an antiseptic swab, clean the injection port again. Insert the medication syringe into the injection port. Then inject the medication over the prescribed amount of time, using a watch for accuracy and staying alert for signs of phlebitis or infiltration. When all of the medication has been administered, remove the syringe.
And now we just have to flush one more time to make sure you got all the med that's still sitting in the tubing, okay? And then after that, we're going to start your IV fluids to keep you hydrated when you're here, okay?
For a medication in a premixed solution that must infuse over time, administer it by first priming the infusion tubing with the premixed medication. Then attach the infusion tubing to the port of the intermittent infusion device. Set the infusion pump to the prescribed infusion time and begin the infusion. Immediately observe the child's IV site for phlebitis or infiltration and recheck it once every hour during the infusion. When the infusion is done, remove the empty medication bag and tubing. After medication administration by either technique, use an antiseptic swab to clean the injection port again. Then insert a syringe of normal saline and flush the infusion device. To prevent blood clots, use the turbulent flow technique by flushing and stopping several times during the flush. When the flush is completed, hold the syringe plunger down, clamp the catheter, and then remove the syringe. This positive pressure technique helps prevent blood from backing up into the catheter tip. If a heparin flush is ordered, unclamp the catheter and inject the solution slowly through the infusion port, using the turbulent flow and positive pressure techniques. While the child is in your care, regularly check his IV site and evaluate the medication's effects. If his therapy will continue at home, teach his parents how to manage his intermittent infusion device. Access a central venous catheter for administering medication through an injection cap or port. First, explain the procedure to the child and parent. Then, with the child positioned comfortably, place a 4x4 gauze pad under the catheter cap or port. After putting on gloves, scrub the injection surface with antiseptic solution for 30 seconds and let it air dry for another 30 seconds.
I'm just going to clean this really good so we don't have any bacteria getting into your medication. And now we're going to let that cleanser dry for 30 seconds.
If fluid is already infusing, clamp the tubing above the injection cap or port. Then flush the catheter using a pre-filled syringe of normal saline.
And I'm going to flush it.
When the flush is done, clamp the catheter and remove the syringe. Now attach the medication syringe, unclamp the tubing, give the medication as prescribed, and reclamp the tubing. Unclamp the tubing again and flush the catheter again with normal saline.
I'm going to give you a little more saline.
If no other medications or IV fluids are required, the catheter should be flushed with heparin. When the last flush is done, clamp the catheter. Secure the central venous catheter to the child using an age-appropriate device. And tape all non-Luer catheter junctions as needed. If you need to start a continuous infusion at a hub, set up the IV tubing for an infusion pump and prime the line.
Jessica.
Whenever you need
It's
to
time
change the
your
dressing
bandage on
for
your
a
tick
tunneled
line.
or non-tunneled catheter, follow facility policy on the frequency and type of dressing
No, it's
changes.
just going to feel like a Band-Aid coming off. I
Okay.
got to pull off all that tape and clean it, put a new one back on. If you want to, why don't you listen to your iPod while I'm doing it?
Okay.
You get it on with that hand. You can get that hand while I start getting my stuff together. You can use this hand.
After putting on non-sterile gloves, remove the soiled dressing carefully, taking care not to disturb the catheter or pull out the sutures and catheter. Then discard the dressing along with your
Okay,
gloves.
Have you hold your arm really still while I put on my sterile gloves.
Assess the catheter for proper positioning in the insertion site for signs of infection. If you see drainage, notify the physician and culture the site as ordered. After washing your hands,
Get my hands
open the
wrapped.
sterile dressing change kit. If the child is immunocompromised, put on a mask and have the child put one on too. Then put on gloves. Using antiseptic solution, clean the insertion site and the surrounding area.
Feel good to get a scratch under
Wipe
there?
in
That's what
circles,
everybody
moving
says.
from the
This is
center
over there.
outward. Then let the area
Good
dry.
scratch.
Repeat this process with a second antiseptic applicator.
And we just have to let that dry for a minute.
Also use antiseptic solution to clean the part of the catheter or tubing that will be covered by the dressing.
It's good you don't have any redness, any swelling. It looks great.
With a PICC line, place a transparent dressing over the insertion site and catheter. Or, for an allergic child, a gauze dressing and hypoallergenic tape.